One of the most uncomfortable moments on a cruise ship has nothing to do with rough seas. It has to do with someone being judged for using an accessibility service when they simply don't look disabled. In truth, many disabilities are completely invisible, and this misinformation can turn a dream vacation into a stressful experience. Hi, I'm Mary, and I'm a Travel Scoop with Robin crew member. In today's video, we are covering cruise accommodations that many travelers don't know exist, disability misconceptions that can happen at sea, and a simple mistake that even the most experienced cruisers can make. So let's dive in. When people hear the word disability, many immediately picture a wheelchair, but that's only one part of the story. Invisible disabilities include chronic pain, autism, hearing loss, epilepsy, PTSD, Crohn's disease, diabetes, multiple sclerosis, severe anxiety, and many other conditions. Some are constant, others change from day to day or even hour to hour. A passenger might walk around the ship in the morning but struggle to stand in line by the afternoon. That's why appearances rarely tell the whole story. Cruise ships are designed to entertain thousands of people all at once. That also means crowds, noise, bright lights, packed elevators, busy buffets, constant activity. For many guests, those aren't minor inconveniences, they're genuine barriers. Someone with sensory sensitivities may need a quiet place to recover. A traveler with chronic fatigue may have to choose between seeing a show or enjoying dinner later that evening. Success on a cruise isn't always about doing more. Sometimes it's about knowing when to slow down. But there's another obstacle that's often even harder to deal with. Many travelers with invisible disabilities hesitate to ask for accommodation. Not because they don't need them, but because they're worried about how other people will react. Unfortunately, comments like "you don't look disabled" are more common than they should be. The reality is that no one can diagnose another person's health just by looking at them. A disability doesn't need to be visible to be real. Cruise accessibility services exist to remove barriers, not to give anyone special treatment. Knowing that can make all the difference before your vacation even begins. Depending on your cruise line and individual needs, you may be able to request accommodations such as priority boarding in certain situations, accessible seating for shows, dietary assistance, refrigeration for medication, communication assistance, support in embarkation and disembarkation. The most important step is contacting the cruise line before your sailing date. The earlier you reach out, the more options may be available. Many first-time cruisers don't realize this until it's too late. And speaking of preparation, here are 5 simple ways to make your cruise smoother. Number 1, learn the ship's layout before boarding. Number 2, pack extra medication in your carry-on, not your checked-in luggage. Number 3, choose shore excursions that match your energy level instead of trying to do everything. Number 4, bring comfort items that help manage your condition, whether that's noise-canceling headphones, cooling towels, sensory tools, or medical supplies. And number 5, build downtime into your itinerary. A relaxing hour on your balcony can be more valuable than squeezing in another activity. Which brings us to the most important message of this video. Invisible disability challenges one of the biggest assumptions people make, that you can tell who needs help just by looking at them. On a cruise, a little understanding can go a long way. Whether you're traveling with invisible disability or simply sharing the ship with someone who is, kindness and patience make the experience better for everyone. Do you agree with the video? I would love to hear your suggestions and thoughts in the comments below. If you found this video helpful, please click like, subscribe, and the notification button. Until next time, see you then.